All right. Good afternoon, everyone. Are you hearing me clear? All right. So, thanks for taking the time out to come to this lecture. This is simply a research project that I did maybe a year ago. All right, where we had students having COVID-19, and we know that when they have COVID-19, a thing called the autonomic nervous system gets impaired. All right, so I kind of wanted to study to see, well, after time, would this thing called the autonomic nervous system, would any impairment that was there, would it be resolved? So this is kind of what this study is about, all right? But what I'll do, I will start out and kind of reintroduce you guys to the autonomic nervous system briefly, and then get into the study. So just to kind of give you a little reminder about this system, and then I'll get into it, all right? Okay. So the title of the research project is Autonomic Modulation, Spontaneous Baroreflex Sensitivity, and Fatigue in Young Men After COVID-19. This study was done at Southern Connecticut State University, and this is our campus, all right? So this is the part where we're going to do a brief kind of reminder of what is the autonomic nervous system. So our nervous system is divided into two main branches. We have the autonomic nervous system and the somatic nervous system. The autonomic nervous system, though, is divided into subgroups. We have what we call the sympathetic branch of the autonomic nervous system, and we have the parasympathetic branch of the autonomic nervous system. Now, the somatic branch of your nervous system, what it does is it deals with conscious activities. Activities you're moving around, all right? The somatic nervous system deals with your muscles. So you think of, oh, I'm going to take up this computer. I'm going to do this. So the somatic branch of the nervous system deals with conscious activities, all right? The autonomic nervous system now, it deals with subconscious activities. So activities that are being performed in your bodies right now that you're not conscious of. Activities such as your breathing, your blood pressure regulation, your heartbeat. So the autonomic nervous system is really important. The sympathetic branch of the autonomic nervous system would be involved, like if you're doing exercise. Anytime you're stressed, or if you're upset, if you're angry, that is the branch of the nervous system that makes your heart start to beat faster and you start to sweat a little bit excessive. All right? So really important, guy, this sympathetic nervous system. Now, we want the sympathetic nervous system to be stimulated in situations where we're stressed, because it kind of helps us out. But if the sympathetic nervous system remains too active for a prolonged period, it can be detrimental to our health. So you're going to find that most people with cardiovascular conditions, they're going to have an overactive sympathetic nervous system. So if you're stressed, all right, and you know that stress is not good for your health, all right, stress represents an increase in sympathetic nervous activity. The sympathetic nervous activity came about because it wanted to get us out of stressful situation. So once you get stressed, the sympathetic nervous activity goes up. It wants to get you out of a stressful situation, but in many instances, it remains elevated. So everybody has experienced stress. So that means that your sympathetic is elevated, and prolonged elevation of the sympathetic nervous system translates into cardiovascular problem in many instances, all right? So that's the sympathetic branch right there, involved, when you're exercising and that sort of stuff. Now, the parasympathetic branch, on the other hand, it's the calming system in your body. So when inhale and exhale and you feel relaxed, that's the parasympathetic nervous system. So if you were to get up right now and run down the road, the sympathetic would come about, its activity would increase, heart rate and everything, but when you're done running, you want your heart rate to go back down, right? So that would be the job of the parasympathetic nervous system. So those are the two branches of the nervous system for you, all right? Incidentally, too much of this guy, the sympathetic branch, will get you into trouble. We want our bodies to have higher parasympathetic nervous system activity. It relaxes you. And that's why yoga makes you feel so good. Every time you breathe and exhale and that sort of stuff, you're increasing the parasympathetic nervous activity from your autonomic nervous system. So remember, autonomic nervous system, excess sympathetic is not so good. High parasympathetic, that is good. You can increase your parasympathetic by exercising. Remember I said that the parasympathetic is the guy that slows down the heart rate. So if you were to be doing aerobic activities, all right, you're running, you're a long distance runner, what usually happens to the heart rate of long distance runner? The heart rate is usually what? Lower. The heart rate is lower. And why? Because they have higher parasympathetic modulation. So just kind of think of it from this perspective. Excess sympathetic, not so good. High parasympathetic is good. Incidentally, as we age, we lose parasympathetic, and our sympathetic gets a little bit stronger, which is one of the reasons behind aging being associated with so many health problems, because we lose parasympathetic modulation. All right. Now, what we've noticed is that when somebody gets COVID-19, the sympathetic gets very high initially. The sympathetic gets very high. All right? So we don't want that. When people have long COVID, all right, they're seeing, they're kind of saying that the sympathetic would be high still. All right? Now, we're spoken about the sympathetic and the parasympathetic. What I want you to know, don't think of them as being guys that fighting against each other. They're guys that actually work together to make us live. All right? So for example, when you're exercising, we want the sympathetic to be high, because that's what's going to allow you to do your physical activity. All right? So, I'm going to start the actual research that I did. All right? So, we know that COVID-19 came around. It claimed the lives of many people, and it continues to claim the lives of people even as I speak. Now, one of the things that we found out was that the autonomic nervous system got upregulated. The sympathetic branch got upregulated during the initial phases of COVID-19. That would allow, we said, it stimulates. Okay. All right. So here now we're seeing the autonomic nervous system as being hypothesized to be associated with COVID-19. Here it is associated with a robust cytokine response. What does that mean? Well, it just means that there's a lot of inflammation that would come about. So remember, when people have COVID-19, they have a lot of coughing, sputum, and that sort of stuff. So they're saying that that came about because of the cytokine response as a result of the excess sympathetic nervous activity. What they're saying is that the parasympathetic in medicine, one mode of treating COVID-19 was, they were saying, well, we should find some way of increasing parasympathetic nervous activity. There are ways of increasing it. But they were saying, well, to treat COVID-19, maybe we should start do research in finding how, increased parasympathetic would help, because we know that increased parasympathetic nervous activity actually helps to prevent inflammation. Okay. All right. Now, we have this thing called baroreflex sensitivity. Baroreflex sensitivity. So our bodies have mechanisms to help us to fight excess elevation in our blood pressure. If you were to be stooping down and then you stand up quickly, sometimes you feel a little woozy, right? When you were stooping down, the blood pressure was at a certain level, and when you get up very quickly, guess what? Your blood pressure dropped. So what happens, we have this thing called a baroreflex. So what does this do? Well, that reflex, as soon as the blood pressure drops, the baroreceptors will pick up that the pressure is low, send it to the central nervous system, and the central nervous system will say, well, heart beat a little faster because the blood pressure is low. Beat a little faster, blood vessels constrict, make the person's blood pressure go up. When the pressure goes up, we're going to have good cerebral blood flow. All right, we're going to have good blood flow to the brain. So when you stoop down and you get up, it's just that the brain is, for that brief moment, the brain is not getting enough blood, oxygen. So that's what causes it. So that time your reflex isn't working as optimally as it should. All right, does this mean anything is wrong with you? Not if it happens a one time or a two time or a three time, but if you have chronic condition where this keeps on happening, then that reflex is not very sharp. It's not very fast. So we want good, fast baroreflex sensitivity. All right? If you don't have good baroreflex sensitivity, that's a marker that you might be having cardiovascular problem later in life. I did a study a couple of years ago where we know that African American women in the United States, they usually develop more hypertension versus Caucasian women. Now, I was perplexed because I'm saying, well, in the colleges, when we check Caucasian women's blood pressure and we check the African American young women blood pressure, we're seeing that the pressure is normal. But after a couple of years, we noticed that, a lot of these African American women, their blood pressure starts to go up, whilst the Caucasian women, their blood pressure is just the same. So I did a study a couple of years ago because I wanted to find out. I was saying to myself, well, maybe when they go to the doctor and the doctor check their blood pressure and it's normal, maybe something else is going on that is going to lead to this high blood pressure in these younger African American women. So I did the study and I wanted to find out if this something could be the baroreflex sensitivity. And what I found out was that the young African American women, their reflex, this baroreflex that we're talking about, it was significantly slower than the Caucasian women. And hence, that kind of led us to the speculation that, well, maybe this is one of the things that is impaired in these African American women that predisposes them to hypertension in the not too distant future. All right, so this thing called baroreflex sensitivity is really important. All right, you lose baroreflex sensitivity before you get high blood pressure. So even if you have normal blood pressure now, and I were to check your baroreflex sensitivity, and it's impaired, that is telling me that your normal bodily response to elevated blood pressure is not working. Again, what is this baroreflex sensitivity thing? When you stoop down and you stand up, that's the reflex. So you don't want to be woozy too much because that means that your reflex is slower. All right? So here, I decided that I wanted to find out about, this baroreflex sensitivity, autonomic function in certain people. Now, studies have been done where they were examining these very parameters that we're speaking about, but they were looking at middle-aged individuals. But one group that they were not doing the research on was young men. Young, healthy men that were in college that had COVID-19. Nobody was doing research on them because they were saying, well, these are young, healthy boys, so, guys are men, so we're not too concerned about them. All right? But they should be. You know why? Because the age group that I looked at was the age group, the young people are the people that usually get COVID-19 more than the older people because the younger people keep on moving around. The older people will stay in. but our younger ones will keep on moving. So that was a problem. You know, they needed to find out about young men that had COVID-19 and were not hospitalized. All right? They had COVID. They are kind of okay, but they had a little fatigue. So we wanted to kind of, hone in on that little group to find out about them. Because in many instances, the very people who need more medical research to be done on them, those are the groups that people somehow don't do as much research on, all right? So, I wanted to find out, all right? You remember we spoke about the fatigue? I said that usually when the people are getting, when they have COVID, they have a little fatigue. When they have long COVID, they have a little fatigue. Now, I wanted to find out, hey, you see this fatigue thing, would it be possible to say that if somebody has fatigue, then their autonomic or their baroreflex would not be working well? I was interested in answering that question. Why? Because to do autonomic research, it takes a tremendous amount of money and expertise. So I wanted to find out, could I, if somebody had COVID-19, could I just look at, and if they have fatigue, I said, well, there's an impairment in autonomic nervous system. So those were some of the things that I wanted to find out. So I set out to do this study, all right? So the primary aim of the study was to compare parasympathetic and sympathetic modulation and baroreflex sensitivity between young men who had COVID-19 versus control. Control were the guys that never had COVID, all right? The secondary aim was to determine whether fatigue was associated with impaired autonomic modulation and baroreflex sensitivity. All right, so that was my aim. These are my two main aims. So how did we go about it? Well, I recruited 44 men. All right, I recruited 44 men between the ages of 18 to 27. Now, I didn't look at doing the research in men that was 18 to 35, 18 to 40. You know why? Because there would be too much variation in the age, and that could mess up your result. So I wanted to keep it clean. I wanted to be specific. This is my population that I'll be working with, all right? Now, the 20 men, we had 20 of these men, they were placed in the COVID group, and 24 was placed in the control group. The inclusion criteria for the COVID-19 group, all right, one, they had to have a positive COVID-19 result at least 5 weeks prior to being tested, being asymptomatic except for fatigue, and never being hospitalized for COVID. So irrespective of the fact that they had COVID-19, I wanted to make sure that these criteria were met. Now, in terms of the COVID, the people that said, well, we did not have COVID-19. How do I know that you never had COVID-19? The only way of really knowing was to do a blood test and test for the antibodies. So we did so that was one of the criteria to put people in the control group, the group that said they never had COVID-19. All right. So we did the test for the antibodies. All right. But after a while, guess what started to happen? People started to get the vaccine. People started to get the vaccine. So what does that mean now? Well, if they're getting the vaccine, they're going to have the antibodies, right? So we had to modify our criteria a little bit and said, well, or have a negative COVID-19 diagnosis and no COVID symptoms since January 20. So we had to modify it a little bit. And that's the nature of research, right? Because we want to be as accurate as possible, all right? But most of the participants in the study, we did do the test for the COVID, for the antibody in their blood, all right? Okay, for time? All right, so when the research that we're doing had to get approval from the university. We have what we call an institutional review board, and to do research, that board you have to write down and tell them what you're going to be doing with the participants, and the board has to say, yes, we sanction this. In many instances, the board said, no, we're not going to sanction this piece of work because it might pose threats to the participants. So we had to submit our IRB, we got approval. But what happened, because it was in the middle of COVID-19, what was happening was that the university and the state of Connecticut decided they didn't want to do any COVID-19 tests, but if the research that you were doing was relevant enough, they would give you special permission, but you had to get special training. So we had to go in and put on the gown. We had strict protocol, how much air should be in the room, the fans had to be going. So we didn't want to get the people to give them COVID, and we didn't want to get anything from them. So we had to go on a special training. All right, so how did this test go? Well, upon arrival, the first thing that we did, we screened them to see if they had COVID-19. We're screening them, we don't really know. We use some of the more insignificant things like body temperature. We said, well, if they're coming in and their body temperature is too high, then we're not going to test them. We're not going to have anything to do with them because we don't want to put ourselves at risk, and we don't want to have them in there and somebody else comes in the room and get ill. All right? The participants, we have what we call an informed consent form. The participants have to give us permission to work on them. All right? So we had to make sure that they understood exactly what they were getting into. All right? So we helped them, with the informed consent sign. If they decided that they wanted to do the study, then we would let them sign it, and then we are in business. All right? So what about this testing? So the participants were directed to sit in a quiet, comfortable temperature control room with no noise. We wanted to keep their autonomic nervous system as low as possible. If I touch one of you right now, your sympathetic goes high. So we wanted them to sit down to make sure that they're properly rested. So we had them rest. Then we take their blood pressure. Then we put on a piece of equipment called a neck fin onto them. All right, this piece of equipment, it measures the EKG. So we put on EKG leads. We put on a finger blood pressure cuff on their finger. Okay, they were asked to breathe at 12 breaths per minute. You know why? Because when you breathe, inhale and exhale, that affects your heart rate. So it affects your sympathetic or your parasympathetic nervous activity. So breathing, we call it respiratory sinus arrhythmia. So breathing actually affects your heart rate. So we wanted to make sure that all the people were breathing at 12 breaths per minute. So any amount of perturbation that his system would be having, breathing at 12, the other person would have the same 12 breaths perturbation. All right? We did an analysis called power spectral density analysis, and that gave us some values. All right? And these values now we use to determine sympathetic and parasympathetic nervous activity. So from now on, this thing called HFRR, that represents parasympathetic nervous activity, and this thing called LFSBP, that represents sympathetic nervous activity. The results. So this was, we just checked. This was the information on the participants. So here we saw their age, their height, and the systolic and diastolic blood pressure. When we compared the non-COVID group to the COVID group, we saw, like, for age, the p-value was 0.41, meaning that there was no significant difference between the group. The groups were similar in terms of the age. So as we went along, we saw similarities. Now, this value, diastolic blood pressure, we're seeing that which group is this? The non-COVID group, all right, they actually had lower diastolic blood pressure versus the COVID group. So so COVID people blood pressure was a little bit higher. When we talk about, have you ever heard a doctor say here 120 over 70? 120 is the systolic and the 70 is, we're running out of time? We're running out of time? Okay, all right. So let me just go to the results again. All right, so what we found was that, I'll finish. Ah. Oh, this is giving me a hard time. So what we found out was that there was no difference between the groups in terms of parasympathetic or sympathetic. There was no difference in terms of the baroreflex sensitivity. So in short, after 6 months, so somebody got COVID, 6 months after being diagnosed, we found no impairment in the baroreflex sensitivity or autonomic function. What does that mean? Well, it means that our findings indicated no difference in parasympathetic modulation or sympathetic modulation and baroreflex sensitivity related to cardiovascular function. These findings suggest preserved autonomic function and baroreflex sensitivity in young men who had COVID-19. All right? So in short, the finding was after 6 months, the sympathetic nervous system, parasympathetic nervous system, and baroreflex sensitivity was okay. But we know that they were impaired at the beginning of COVID-19, but after 6 months, everything worked out. All right? Thank you for your attention.
Thank you too, Dr. Latchman. And I'm glad to hear that we can heal. Yes, that is what I'm taking away from all of this conversation. All right? And